Good morning, everybody, and welcome back to your Lunch Break Live. Today is Friday. We made it. It is June the 11th. If you have been keeping up with me since, I can't even remember now, March of 2020, you might recognize this face. This is UAB epidemiologist, Dr. Suzanne Judd. Dr. Judd is here to talk about something that we all are thinking about, and that is herd immunity from coronavirus, from COVID-19, as we all are using it in daily conversation now. Dr. Judd, let's jump in it. And first of all, thank you for taking some time to speak with us. But I think about the last time you came on the show and how we talked. I believe that was in maybe April-ish or maybe late March. And you said, look, we could get to herd immunity pretty soon because we're getting vaccines. They're going to be very available. And it was such a piece of relief, I think, to me and to a lot of people watching. I remember I got off of this and I was like, oh my gosh, we can really do this. But maybe we can do it. But at this point, it seems like we, and I say we as an Alabamians, are not doing it.
That's right. We're not getting vaccinated at the same rates that other states are in the United States. And one of the ways I like to think about this when I talk to people about what herd immunity is, if you can imagine water that's traveling through a pipe. The pipe's on an angle, so it's flowing through the pipe. If it's just water moving through the pipe, that's what the population looks like when it has no immunity. That water just whips through the pipe and gets to the other side. Where we are in Alabama, it'd be like honey flowing through the pipe. It's going to move slowly. It's not going to get there as fast as the water, but it's still going to get to the other side. Herd immunity is like concrete moving through the pipe. It doesn't go anywhere. Nobody gets sick at the other end because there's enough immunity that the virus just simply can't spread. That requires 70 or 80% of the population to get vaccinated in Alabama, and it just doesn't seem like that's where we're going to get. So we're going to be more in that honey area where we have cases every week. We have people in the hospital every week, and unfortunately, we'll have deaths every week because our vaccination rates just aren't high enough.
You know, and it's kind of like I like that analogy, and that's easy to understand for those of us who are not in the medical field like myself. But we talk about we can get there. It's not that we can't, it's that we aren't. And those are two very different words. Can't means that we don't have the means to get there. But it looks like in Alabama, we do have the means. We just aren't accepting those means. We aren't doing the work. Is that a fair characterization?
That is a fair characterization. And for people that haven't followed public health through the years, this is very normal in public health. There are always a portion of the population that are very engaged in their health. They don't want to smoke. They want to wear their seatbelts. They eat in a healthy way, and they tend to get vaccinated. So those people are easy to get to right away. Then there's the next group of people that says, well, I just don't know if I believe these recommendations. I don't know if I have to get vaccinated. Do I really have to eat healthy? And that group's a little bit harder to engage, and they usually require policies. So mandatory vaccinations. That's one of the reasons that vaccines are required for children to go to school. That's our most effective public health tool to get people vaccinated. If you have to be vaccinated to go somewhere, people get vaccinated.
I want to look at some data here. I'm going to read it off so I don't mess up these numbers. And this is from the CDC. It says that about 43% of Americans are vaccinated. That is Americans across the country. Now, that's, as we said before, that number can kind of fluctuate up and down, but we're going to say 43% for the purposes of this interview. Using that same denominator, only 29.5% of Alabamians are vaccinated. So that's a big discrepancy between the national vaccination rates and the Alabama vaccination rates. So, Dr. Judd, why is this happening? Why are so many Alabamians not taking the opportunity now that we have available vaccines to actually get vaccinated?
There are a lot of reasons people choose not to get vaccinated. Some of it is just the effort to go to the pharmacy, to go to UAB, wherever it is. It's that effort to get there. Maybe they're busy. Maybe they're working two jobs. It's just very hard for them to get out and get vaccinated. This one does require 15 minutes. So it's not simply, I'm going to go out and get vaccinated. You've also got to wait. And then in some people, they do have side effects for a day or two. So then people also say, oh, I don't want to be sick, so I'm not going to go get the vaccine. Even though it's not sick like getting COVID, it's just small symptoms after the vaccine, they still don't want to do it. So you've got this group that just does not want to go out and get vaccinated. So we have to find ways to motivate them because, again, their health doesn't motivate them. So then the next step is, like I said, it's either policies or incentives, paying people. You're hearing that batted around a lot, where you could be entered into a drawing to win, or maybe you get a free coffee or a free beer. I think I even heard somewhere. maybe those are the things that get people in and get them vaccinated. But we have to find that carrot. What gets people in and gets them vaccinated?
Speaking of that, I have a comment here, and I think it's pretty great, and it would probably work. Steve Robbins says, just have a lottery for some Iron Bowl tickets. And suddenly he said, everybody's vaccinated. And Steve, you might be on to something. I definitely think that is, that would be an incentive there.
I think it would be.
Now, we talk about these vaccines. There's apparently a lot of either, as you said, people just not wanting to put in the effort to go get their vaccine, to wait that 15 minutes, to worry about having symptoms maybe after one of their shots. We know not everybody does. Some people do have those symptoms. It might be something discouraging people from getting vaccinated. But there's another group of people that are not getting it, not because of those reasons, but because they don't trust the science. They don't trust the vaccines. They either think that they were approved too early on, that there wasn't enough research. They believe it's a political issue, etc. What do you say when you are presented with those arguments?
I let people know that the vaccines are very safe. We now have 6 months worth of clinical trial data. Not only that, we've got hundreds of millions of people that have been vaccinated, and the side effect rate is extremely low. One article that might talk about, say, inflammation around the heart or blood clots. Those were the two big ones that came out. That starts to scare people, but they shouldn't be scared. They're very, very low rates of both blood clots and inflammation of the heart. And to be honest with you, COVID has nearly 10 times to 100 times the rate of those two conditions if you get infected. So again, it's one of those balancing acts of, sure, there might be a few symptoms, and occasionally there are some serious symptoms from the vaccine, but it's nothing like the infection. And that's what I tried to get people to focus on. The fact that the vaccine is very safe, especially relative to infection. And then I also, in Alabama, point them to the statistics. Back in January, February, March, we saw lots of 75-year-olds in the hospital. They were one of the highest rates of hospitalization in the state. They've almost fallen down below the 16 to 30-year-olds. At this point in time, we have more hospitalizations in 30-year-olds and 50-year-olds than any other age group. 30, 40, and 50, I should say. So it's really important for people to know the virus isn't gone. And if you're young and you haven't gotten vaccinated, you're at risk of getting the virus and winding up in the hospital. So it's about weighing those risks for yourself. Do you want to risk the infection or just a couple of days of side effects?
Now, it's interesting you bring, and I'm going to be looking to share my screen here for a second. It's interesting you bring up that point about how the 30 to 50-year-olds are the ones being hospitalized right now. That is the higher rate of hospitalization. I want to share something here on my screen. And this, if you can see this, I know that the wording is a little bit small, so I will break it down for you. But this is an age bar graph. This is from the Alabama Department of Health. I did not make this. Dr. Judd did not make this. This is a state website. Now, look at these bar graphs, and this shows the age ranges of people getting vaccinated. Now, it might surprise you. It definitely surprised me that the lowest range of people getting vaccinated is that 30 to 49-year-olds. Only 14.1% of Alabamians in that age range have been vaccinated. Dr. Judd, is that a direct correlation with the low amount of people in that age group getting vaccinated versus the amount of people in that age group being hospitalized?
It is. It is. The bulk of hospitalizations are occurring in unvaccinated people. So the longer you go and wait for the vaccine, because you think that the virus is going to go away, you're running the risk of being one of these people that winds up in the hospital. It's definitely a direct correlation.
Now, I'm looking through some of these comments here. I do have one person asking about, is Nick Saban going to make a statement? And I will tell you, I think it was Marissa that said that. I will say that Nick Saban, actually, we had some reporting on, he did film a public service announcement about a month ago or 6 weeks ago, encouraging people to be vaccinated. So he has kind of made his statement there. I will find that reporting and share it with you if you're interested. Dr. Judd, what about, I've got some people saying, look, I'd rather have natural immunity. Mm-hmm. What do we know rather about natural immunity? What do you say to people who have had coronavirus and said, look, I don't need the vaccine. I already have immunity.
So the natural immunity is, that's another one that makes me laugh, because there's no such thing as natural immunity. You weren't born with immunity to COVID. So when people say natural immunity, I think that what they're meaning is that getting infected is more natural than a vaccine. But I would say that is not the case at all. Vaccines produce the very same types of protein that allow your immune system to respond. So you get the same level of antibody response, natural antibodies that come out. So there's really no such thing as natural immunity. Infections are not natural. It's not natural to have a viral infection, and it can put you at serious consequences down the road. I'll give you an example of one, and that's chickenpox. People of my age all had chickenpox, and now we're at risk of shingles because that virus can lie dormant in your body for years. A vaccine can't lie dormant. The vaccine keeps you safe, but doesn't allow this virus to hide it either in your stomach or other places and then pop back out again when you least expect it and cause misery in your life. So when I hear people say natural immunity, I think, what do you mean by that? Because you sure weren't born with immunity to COVID.
And another argument that we hear a lot is we don't have herd immunity for the flu. And I'm not a medical doctor. I think we all have figured that out by now. But I do think that it's interesting that flu is something where the strain that comes around changes every year. That's why you have to get a flu shot every year, because it's not the same makeup. I am not a biologist. I'm not even sure I passed my high school biology, but the biological makeup of the flu is different every year. And that is why we get that shot. And that's why we're not achieving herd immunity from the flu. Is that a fair response? Or what do you say to people who have that question?
Partially, it's a fair response, but also we don't get vaccinated for the flu at high rates. So we tend to vaccinate very young people, like young children who are going to a pediatrician and just getting a series of shots. And older individuals, 65 and older, are usually willing to get vaccinated. But again, that group that's between about 10 and 65, they rarely get vaccinated for the flu unless they've got a family member they're trying to protect. So in a good year, we might get 20 or 25% of the people vaccinated for flu. Now, it is true that it mutates too, and it does mutate more rapidly than coronavirus. And not to split hairs, but there are multiple types of influenza, and there are multiple types of coronaviruses. So once you're vaccinated for that one type of influenza, you're kind of clear, but it changes. Just like this particular virus is SARS-CoV-2, but there was SARS that was out in 2003. So all of these viruses, they do mutate and change, but this one in particular, once you get the shot for SARS-CoV-2, it really does look like it lasts, that the immunity lasts. At least now we know 6 to 9 months. In the fall, we'll know whether it lasts a full year. And the same thing was true of the SARS infections that were in Asia in 2003. Once someone developed immunity to that SARS virus, that immunity stayed with them. So it is a little bit different than the flu. And also remember, people just don't get vaccinated at high rates for the flu. So I would compare it to measles. I would not compare it to the flu.
That's an interesting point there. And you talk about the vaccines and how we don't know if we're going to need a booster yet. When do you think that we, and I say we as just in America and the world in general, will know if we need a booster for these 3 vaccines that are available in the US for Johnson & Johnson, Moderna, and Pfizer?
In about September, October, November. It's when the people that were in the original clinical trials, when they have been seen for their 12-month assessment. After we know in 12 months what their immunity looks like, then we'll know whether or not we need a booster. And you'll continue to hear about it from probably the fall through the early spring as we start to see what happens to people that got the early rounds of the vaccine, and we can see how their immunity wanes. So it'll be a while. Hang tight on that one. That will not be answered for probably 3 to 6 months.
And I know that that's something that, especially those of us like myself, who's kind of a planner, it's hard to think, we don't know if you will need a booster, et cetera. But do you think it's worth going ahead and getting vaccinated and dealing with that as it comes, or waiting to find out?
No, I think it's worth going ahead and getting vaccinated and dealing with it as it comes. One of the things I tell people all the time, we have vaccine in Alabama right now. CVS and Walmart and UAB, they're buying doses so that they can give them to Alabamans. If Alabamans choose not to get vaccinated, then they might take those vaccines and give them to other countries. I mean, it's supply and demand. If CVS doesn't need to order them, they won't. And then what happens if you really need the vaccine? And now we're in a crunch again to get vaccine because it's been given to other countries or other states. So the vaccine is here now. Now is the time to get it.
I was just pulling up some information. Somebody had asked about death rates in Alabama. In Alabama, there have been, since the start of the pandemic that has been recorded, there have been 11,266 Alabamians who have died from coronavirus, from COVID-19. So just wanted to answer that here. Now, let's pivot quickly, Dr. Judd, to talk about this Delta variant. That is a variant of coronavirus. We've been talking about mutations, and that is one of them. I spoke with Dr. Bashar Shukair. He is a vaccinations coordinator for the White House last week. And he said, look, we've seen a lot of young people who are not getting vaccinated because maybe when vaccines came out, if they were in school, they had final exams, they were trying to get home, or they were trying to get their summer started, and they said, look, we'll get vaccinated later. So that was something that he said he was worried about, especially in that young age group. We know that this variant can spread very fast and can be a little bit more easily contagious, as we'll say, part of that spreading fast. Dr. Judd, do you see this variant becoming a problem in America and in Alabama?
It depends, again, on vaccination rates. The good news is that the vaccine appears to work on the Delta variant. So people that are vaccinated, again, can feel comfortable that this vaccine seems to work. It might work at a slightly lower rate, but we're not talking about not working at all. So the efficacy may go from 90% down to 80 or even 70%, but that's all great. Again, that's much better than zero. So again, if you've been vaccinated, you don't have to worry as much about the Delta variant. Although people who haven't been vaccinated, especially if it's groups of people, like let's say that everyone in your county is choosing not to get vaccinated, or at your high school or your college, if all of your friends are not getting vaccinated together, if this variant winds up somehow making it into your circle, everyone in your circle could get sick. So that's the scarier part, is that people tend to do what their friends and family do. And if you're a part of a friend circle or a family group that's not very keen on vaccination, if that variant makes it to your group, that could be quite devastating.
And, in I guess advice to those people, I've got a comment here from my friend Dana, and he says, just ask your doctor. Yeah. Ask your doctor what they think. And that is great. Great advice there, Dana. Now, quick, again, I keep saying one more, but one more question, Dr. Judd. We've got 29.5% of Alabamians vaccinated. What do we need to get to herd immunity in Alabama?
That's a great question. We just don't know, because so many people actually had the infection. So we don't know how many people actually have immunity. I always say, check the cases, watch the cases. If we can keep the 14-day case count under 2,800. So if you go to that ADPH dashboard, I love it. You just click on the data and surveillance tab. There's a 14-day number. When it's under 2,800 and we have less than 200 hospitalizations total in the state, we're at a comfortable level. I don't call it herd immunity, because it would be zero. We'd have zero cases if we had herd immunity. So I call it comfortable. That's where we can get out and about, where we can do what we're doing right now. The data indicates it's perfectly safe to move around and go have coffee with your mask off if you've been vaccinated. So that's what I recommend people do. Don't look at who's been vaccinated, but look at the case numbers. When you see those case numbers tick back up again, that's when you start, especially if you're one of those people that's on the fence about the vaccine, start thinking about getting the vaccine again.
Good advice here, Dr. Judd. Again, as we said, talk to your doctor, talk to your pharmacist if you have questions, and just talk to your trusted medical advisor there. Dr. Judd, thank you so much for your expertise here. Again, I know that you've been a repeat guest here, and I cannot say that you won't be called on again. So, Doctor, thank you so much for all of this information and for all of the research you're doing to keep us informed.
Absolutely. Thanks for having me, Ivana.
Everybody watching, thank you so much. Have a great weekend. Hopefully that sun is going to come out soon and you can enjoy it. We will see you next week.